So this is going to be a demonstration of the flexor muscles of the forearm and the neurovascular structures. This is a supine cadaver and this is the right leg. The camera person is standing on the left side. My right finger, index finger, is located on the medial epicondyle. This is known as the common flexor origin, where all the flexor muscles take origin from. So the flexor muscles are divided into three layers. First, second and third layer. So let's take a quick mnemonic. Layer number 1 is PFPF. P stands for pronator teres, and this is the pronator teres muscle that we see here. The pronator teres muscle has got two heads. The first head is the common flexor origin, that is the humeral head. And deep inside we have the next head, which is the one I picked up now. This is the ulnar head. So humeral head, ulnar head. And in between the two heads we can see the median nervous passing. That is the first P. The next F is this one. This is the flexor carpi radialis. Then we have again P. It is this. This is the palmaris longus. In this case it is very thin, but it's usually a little thicker than this. And this palmaris longus tendon does not have much anatomical use. However, it is used for tendon grafting and tendon transplants. And the next F is this tendon which I have picked up here. This is the flexor carpi ulnaris. The flexor carpi ulnaris has got an aponeurotic expansion, and we can see this aponeurotic expansion here. This merges with the antebrachial fascia and it also forms a tunnel, and my finger has gone into the tunnel, and that tunnel is known as the cubital tunnel, where the ulnar nerve can get entrapped to produce what is known as the cubital tunnel syndrome. So these are the first layer of muscles, PFPF. To recap again, pronator teres, flexor carpi radialis, then we have the palmaris longus and flexor carpi ulnaris. Layer number 2 is this muscle here. This is flexor digitorum superficialis. This is flexor digitorum superficialis. This muscle has also got two heads, a humero-ulnar head and a radial head. And passing between the two heads, again we have the median nerve. The median nerve passes between the two heads of the flexor digitorum superficialis, and we can see after the median nerve has passed through, it comes out between the two heads of the flexor digitorum superficialis. That is layer number 2. Then we have the third layer. Space between layer number 2 and layer number 3, that is known as the neurovascular plane, because most of the blood vessels, main blood vessels, run in the neurovascular plane. Now let's come to layer number 3. The layer number 3 is here. The layer number 3 is composed of 3 muscles. The first muscle that we see here, this one, we can see the tendon here. This is the flexor pollicis longus. This also goes through the carpal tunnel. Next muscle is this combined muscle that I have shown here. This is the flexor digitorum profundus. And deepest of the layer 3 is this muscle that we can see here. This is the pronator quadratus muscle. The pronator quadratus muscle is stuck onto the bones, and the space between the flexor digitorum profundus and the pronator quadratus, where my finger is located, this is known as the space of Perona, which is clinically important space. This space of Perona communicates with the mid-palmar space through the carpal tunnel. So this is layer number 3. Coming to the nerve supply of the flexor muscles. A rule of thumb is the median nerve supplies most of the muscles of the flexor compartment, except the medial half of the flexor digitorum profundus and the flexor carpi ulnaris. And these 1.5 muscles which are not supplied by the median nerve, they are supplied by the ulnar nerve. So this is the nerve supply of the muscles of the flexor compartment. If there is injury to the median nerve in the forearm, then it will lead to paralysis of the flexor digitorum superficialis on the flexor muscles, except the medial half of the profundus and the flexor carpi ulnaris. And then the patient will have a few manifestations. One of them is known as the simian hand, where the thinner muscles will be atrophied. The other manifestation will be what is known as the Pope's hand or the hand of benediction. When you ask the patient to flex his digits, he will not be able to flex his lateral 3 digits. This is known as Pope's hand or the hand of benediction. So this is one manifestation of the median nerve in general. Likewise, if there is an injury to the ulnar nerve in the elbow, then it will lead to paralysis of the medial half of the flexor digitorum profundus and the flexor carpi ulnaris. And then the patient will develop what is known as a radial claw. When you ask him to straighten his fingers, the radial side of his fingers will be clawed like this, and that is known as a claw hand. So these are some of the common manifestations of injury to the median nerve and the ulnar nerve. So these are the structures that I wanted to demonstrate to you on the flexor aspect of the forearm and the neurovascular structures.